And here we go. Hello, everybody. This is Dr. Jeffrey Hanna here at Chiropractic. And I had a question that somebody asked me through internet. And it was, how do you test for thoracic outlet syndrome? Now, let me back up a little bit here. It was following a conversation about tingling and numbness in the hands. And it was following up a video that I'd done before that talked about that not all tingling in the hand is necessarily carpal tunnel syndrome. Instead, it can be what's called double crush. It's where you have a problem. Yeah, there's a problem in the wrist, but this only applies for about small percent of what's actually going on. There's a far greater probability that something going on upstream is actually affecting the course of that nerve, and that's what's producing tingling, numbness in the hands. But the question was, what if it was the entire hand? What does that mean? Okay, well, there's a few possibilities there. One possibility is that we are dealing with what's called thoracic outlet syndrome. What that is where one of the major arteries that's supplying blood to your hand is actually getting constricted. Oftentimes, this is going to be because we have certain muscles that are tight, and I'll get back around there in a second, because we always need to ask the question, why are those muscles tight in the first place? If we're dealing with a true blue thoracic outlet where the artery is getting constricted, gold standard test is a diagnostic ultrasound. That will show you if you are dealing with narrowness of those particular arteries. But there are a few very, very simple tests that you can do on your own to find out if there can be something that's going on in this regard. So what you do, you first have to find your pulse. And you come out on the outside, right there, outside of your wrist. Don't push very hard, but just look until you find the normal pulse. Once you do, what you do is you turn your head to the side and lean it slightly back. What that does is that creates tension through some of the arteries. And what you're looking for, what you're feeling for, is if that pulse amplitude gets significantly quieter. Now, if it is not super duper abundant, you're like, oh, maybe it's a little bit lower. No, it's considered normal. It would be there is a very appreciable decrease in your pulse. So you go like this, the one way, and see, does your pulse go down? Then you turn your head the other way, because now you're testing a slightly different muscle to see, does that go down? If the answer is yes, okay, we know that we're dealing with an issue there. If the answer is no, go on to the next test. What you do is you roll your shoulders forward like this, kind of like you're going to be doing that movement, and lean your head straight back. So you bring your arms, so like you tighten your pec muscles, lean your head straight back, look to see does the pulse go down, and if that doesn't, then try the last one in the series. You pull your shoulders straight back and tuck your chin down to your chest. If you're doing the very first one, that means that you have tightness of the anterior scalene muscle on that side. If you're doing it with your head going the other way, that means that you have tightness of the middle scalene on that side. If it's when you're crossing your arms kind of like this and bringing your head straight back, those are the pec muscles. And if it's the head going back like that, that can be something either involving the first rib or the clavicle joint. Now, even in and of itself, that does not necessarily address what is causing that issue in the first place. And there's a phenomenon which is known as upper cross syndrome. This is where, for one reason or another, the muscles on the front of your body are way too tight. They're way stronger than they are relative to the ones in the back. And the consequence of that is that the head starts to come forward like this, which creates tension in those particular muscles. And this is where it's very important then to either work with a exercise physiologist, physical therapist, massage therapist, where you need to release the tension through those muscles. And that can be a very, very sore kind of process, but very simple. You look to see after loosening that muscle, does that actually increase that pulse pressure? If so, awesome, problem solved. Now, if you do that and it still isn't solving that, what that suggests in that case is that there is probably something that is not moving properly in your neck. And what's happening is it's causing your head to compensate by going forward. In other words, Those tight muscles in and of themselves are not the primary cause. They are the effect of something else that is going on. So whether, again, we are dealing with a carpal tunnel, a double crush, or a thoracic outlet syndrome, it's very, very important to make sure that the alignment, the mobility, and the stability of your neck is actually moving the way that it is supposed to. Hope that that answers that question, and we will chat with you next time. This is Dr. Jeffrey Hanna at Clear Chiropractic. Get well, live well, stay well.